Today marks the 118th day of this outbreak in Fiji. In regards health services, the Central and the Western Division are continuing in the mitigation phase, and the subdivisional teams in the two divisions are running the response in their respective areas. COVID test?
Yes, this is the rapid test. Eh? Yeah, you want me to do that? And then you strain it. And do that. Wow. So, put one more. The more the better. Yeah. Set. You can see this. There's one line along the control. Look at this test line. There's also another line there if you look at it. So this patient is COVID positive. This is a sample of the form. It's a confirmation of COVID-19 result, isolation quarantine order. This form tells the patient that patient is COVID positive and advises them to start home isolation for 14 days. Before they can get their clearance.
So basically we are part of the Nasinu EOC team. We look after all our high-risk patients. High-risk being those who are above 60 or those who have comorbidities that actually make them at higher risk of complications once having COVID. At the moment we're heading up to Cunningham. We have a few patients that are meant for discharge. So for us to discharge any patients, we have to see them, take their vitals, and just make sure everything's okay before we actually give them a discharge. Unfortunately, it's a very rainy day, so we actually have to brave the winds and the rain so we can see these patients and make sure all of them are fine.
We've been doing this for up to about 5 months now. Most of the time when everybody else is sleeping, there's a few of us who stay up and await calls, and we support our teams that are out on the ground at night. So we get to receive the calls first before we give it to our teams on the ground. And it's not easy. I always tell my team to just put themselves in their shoes, the patient's shoes, and so that whatever call comes, we respond. I have a team of 106 personnel. The medical personnel, it's made up of staff from different ministries. Medical personnel are the ones that go out to the community. They are the field teams or the response teams that visit the positive cases at home, and they also attend to all the emergency cases that we get that are sent to us. The rest, in terms of logistics, support and admin, is mainly by other ministries, staff from other ministries. So we have those from Ministry of Women's, Itoke, Youth and Sports, Agriculture, all the ministries. It came to a point where there were only maybe 10 of us left. They were negative and the rest of the team had to go in isolation. But we continued.
It was also scary, like I had mentioned to you when I became positive. Like I was more, I shared about my parents being scared, but there were moments where I was terrified because when I was in isolation, I would be a bit short of breath. It was very difficult for me sometimes to talk, even if I tried to laugh, and I laugh a lot. So it was very hard for me. I would find it difficult to breathe, and those were the moments that it would hit me like, you know, what if something happened to me and my son, yeah? So those were things, even though I knew the risk that I was taking, it's scary.
How we responded to that, since we have to, the cases build up every day. Now it has gone down, but at its peak, because we were just having thousands of cases every day, what we did was just make sure that everybody learned everything that had to be done.
Show. Analyzing interrupted. Do not touch the patient. Stop.
The training that we've been having allows the different teams to be able to work together as we respond further and further into the interior, and we're having to engage when the crews go out. We have a mix of non-clinical and clinical members on board a crew, and so with that in mind and the fact that we are further away from any health facilities, we have to get everyone to even as something as simple as familiarizing with the equipment, something that will be able to help the clinical members of the team be able to provide more interventions for a patient who needs our help. And so that's why we conduct this training. The training is also a means of having the different teams collaborate more and synergize more. We usually see each other only out there when we're responding out into the field. So having the opportunity for us to get together also allows us to collaborate further, strengthen the relationships that we have between the agencies and the personnel that are working. And yeah, it's only better for the patient.